risk factors for preventable chronic diseases are tobacco use, lack of physical activity, and excessive alcohol use. The risk factors have caused unpreventable and preventable diseases like disability and death. To reduce these risk factors, prevent diseases or injury before it ever occurs, reduce the impact of a disease or injury that has already occurred, soften the impact of an ongoing illness or injury that has lasting effects. We all need to invest our time and money in improving healthy lifestyle behaviors by increasing physical activity and improving our diet. By doing this, almost 35% of early deaths will be avoided. Our integrative nutrition health specialist, Betty Olayinka Folari Akinlosotu, aka BOFA, advocates for this every Sunday on Health Corner and Nutrition segments showing on Healthy Living with BOFA channel, where she also features professionals on interview with expert segments. Join us every Sunday, 2 p.m. U.S. time, 7 p.m. UK and Nigeria time, 8 p.m. South African time. See you there.
Yes, so welcome back on the show you love so much. In case you're just joining us for the first time, this is Healthy Living with BOFA show, a show that educates, sensitizes, and empowers on healthy living, wellness. We want you to live your way into a healthy and beautiful body. That's what we do here. I'm Betsy Olayinka Folari Akinlosotu, aka BOFA, an untiring and inspiring wellness advocate coming to you live on YouTube channel. Here we are today doing what you love to see and hear about wellness. And thank you for joining our broadcast today. I believe we all enjoyed the show and we learned one or two things from the show last week, including myself. Trust me, I learned so much because nobody knows all. And today we're also featuring a guest from a medical field. And I'm sure you can't wait to meet our guest on the show today. So let's take a quick break. When we return, we bring you our interview with experts. You are our guests on the show today. All right, welcome back to the show you've all been waiting for. As you can see, our guest is on the show right on time. So now we're gonna get started to you officially. And this is what we do on this show. Before I introduce my guest on the show, tell you who she is, I want us to understand that with no doubt, health information undoubtedly has great social, political, and economic importance in our lives. To have relevant information, it means to have basis for timely reporting, basis for action, and prerequisites for success. Today, we have a medical officer, Dr. Morohunmubo Ibiyo, who will also be educating us on health, basically on how it is important we check our health status. So we want to take a look at the way we must do it. How do we measure our health status, our health conditions? How do we go about it? What are the things that we must do to make sure that we are in a stable and healthy condition? So today, I introduce to you Dr. Morohunmubo Ibiyo. Dr. Ibiyo studied biochemistry at Ahmadu Bello University, Nigeria, and later proceeded to earn a Bachelor of Medicine, Bachelor of Surgery at University of Ibadan, Oyo State, Nigeria. Dr. Ibiyo has several certifications, including emergency obstetrics and newborn care. Ibiyo is a creative director at Safair and Purple Palace. Dr. Ibiyo, welcome on Healthy Living with Bofa Show, interview with experts. How are you?
Thank you for inviting me. It's a pleasure from my end. I really appreciate this and this opportunity to promote health. It gives me great pleasure. So thank you so much for inviting me. I appreciate you again. Thanks.
You're welcome. Let me first appreciate you for honoring our invitation to join this esteemed initiative to educate us and share your wisdom and experience with us on the show today. There is a cloud, a darkness around few things we need you to brighten up or put a light on. We've got some questions we would like you to answer today, right here on the show. Should we proceed?
I guess we should get to the show immediately. The audience can't wait.
Thank you. They can't wait. I'm telling you. Thank you so much. God bless you. Now, let's start with, why is it important people know their health status?
Now, that's a tricky question. I would like to simplify this as much as possible, considering that I'm not talking to just my colleagues. I'm talking to non-medical population out there, people who need to know about their health. So I would like to just simplify this as much as possible. It's as simple as asking that, why do I need to maintain my car if you have a car, for instance, or why do I need to maintain a building or an instrument? It's all about the function, really. So knowing your health status, like we have in the topic, is also a test of your knowledge and your understanding of your body. You can't keep walking your body and you don't know anything about your body.
Right.
So it's also a pointer to how much you love yourself. So really, why do we need to know about our health status? It tells about your body and the level of function. And now when you know how much you can push your body, talking about level of function, it helps to boost your confidence. It helps to boost your planning. It affects your budget. It affects your finances. We're talking about health here. One of the most interesting definition for health was given by the WHO in 1948 about health being a state of well-being of the physical, the mental, the social health of an individual, and not merely the absence of diseases or infirmity. That made it quite interesting that by not having a disease you're managing or not having an infirmity may not immediately mean that you're healthy. In these times, a lot of schools of thought have even integrated spiritual health into the matter, financial and economic health, social health, psychosocial issues are coming into. In fact, environmental issues are playing their role in health. So it is important to understand all these factors, all these determinants, so that you can function at the optimal level. So the question I would like our viewers to have at the end of this show is that, how much do I know? How much do I understand about my body and the function of my body? And also at the end of this show, I would like you to be able to judge for yourself whether you have an excellent health status, whether your health status is good, very good, fair, or poor. You need to be honest with yourself, because then that would affect the action you will take after this show. Because if you deceive yourself that you are healthy and you are not, it's going to affect your actions and your initiative after this show. So we're going to dabble more into how this even affects us at the population level. I said earlier that your health status helps to boost your confidence and affect your planning. it actually gives you the opportunity to identify the risk you are exposed to and then take action. It will guide your future decisions about your health. Take, for instance, if I walk into a doctor's room today and I have my fasting lipid profile checked, and then there's the possibility of abnormal cholesterol level. When I leave the doctor's office, peradventure, he's going to hook me up with a dietitian. I'm going to have a review by a dietitian. I'm going to understand how I can use diet to influence my lipid levels. And if I need to commence medications, it will be prescribed. But if I never walk into a doctor's office, I will never find out that. Do you understand? I will never find out that. So it helps our decision making. And it's funny that the things we ignore, for example, oh, my cholesterol is a little bit high. Stroke is real. You don't want to get to the level of disability to understand or to wish that you had taken better decisions in the past. And then with the example I gave, it helps you understand and identify indicators to monitor and track. That is why you need to know your health status. And at the family level, if a member of the family, like the example I gave, dyslipidemia, deranged lipid profile, if a member of the family has problem with lipid levels, it's going to affect the diet of the entire family somehow. It's going to affect the attitude of other members of the family towards health generally. And everybody is going to take the initiative to go see a doctor or run a checkup. So if I want to project to the population level, if every member of the society pay attention to their health, then it's going to affect our local indices, our national indices, and eventually our global indices. So it's important to know our health status because it's only a healthy person that can work. It's only a healthy person that can enjoy life. You can't be sick and be throwing a party. I wouldn't know, maybe. It depends, but it's very unlikely for you to be very sick and be throwing a party at the same time.
That is impossible, doctor. That is too loud.
Well, we can't say completely because we have people with terminal diseases. So in order to maximize the later part of their life, they are allowed to do such things that make them happy. But I'm just emphasizing the point that you cannot be in a state of dysfunction and then also enjoy life at the same time. So these are some of the reasons why I think anybody should pay attention to their health, because it helps you optimize your potential and then pursue your aspirations in summary. Thank you
so much, doctor. In fact, I enjoy every bit of words that came out of your mouth today. God bless you. Now, doctor, what is the best way? You've mentioned some that going to the doctor and do the checkup. What are other ways to measure our health status? How do we measure it? And what does this measurement include in terms of science?
Thank you very much. Before we go into science, we also need to deal with the individual. Your willingness to accept that you are in a state of dysfunction. You have some people who have backache, and because they are in their middle age, they assume that that is normal and it's part of aging, and they don't bother about it. Whereas if they probably see their doctor, they're going to get some health education and understand that they need to start making some adjustments and modify their behaviors. In terms of science, like I said earlier, the best way is to walk into a doctor's room and say that you want a routine checkup. Of course, your doctor, it shouldn't be abnormal, but when people do that, we are proud of their decision, because once they walk in, you are able to take history, assess their risk, profile them, and then that will also give you an opportunity to examine them before we then go into investigations. So the history and the examination helps to personalize whatever intervention that will be made. Do you understand? So we can depending on the age group really. If I want to start from the basic, I would say that we should begin to take things like preconceptional care seriously. You don't just get married and ignore such things. You might be low on some micronutrients that is going to help you if you take in paraventure. And even if you're not willing to, understanding how your body functions before you take in is very important, so that you won't land into emergencies and it's going to be managed appropriately. The pregnant woman too needs to make it a point of call to attend an antenatal clinic. Some women, especially after they've had maybe one or two deliveries, feel like, oh, what are they doing there that is exceptional? I understand the process. And so they don't register the next or the index pregnancy, as it were. And what we need to understand in that situation is the fact that every baby, every pregnancy is absolutely different. No two pregnancies are the same. Looking at the adolescent age group, we need to be mindful of their food behaviors, like risky sexual behaviors. You need to pay attention to educating them about these issues, because they're going to get exposed whether we like it or not. And then making them understand and educating them about these issues will help them take better decisions, make better decisions about their health. And those who want to abstain, for instance, will abstain. Those who want to be faithful will be faithful. And those who want to use condoms, like we'll say, will use condom. But the most important thing is that we are protecting and preventing risk for disease. A middle-aged man, for instance, who is training on urination should not just assume that he's getting older or you have a burning sensation on urination. For all you care, you might begin to have an enlarged prostate, which is resulting in stasis. I don't want to go into the medical nitty-gritty, but that is an opportunity for you to see your doctor. An indication actually for you to see your doctor, because then when you're able to run the serum prostate antigen and know your level, baseline level as we call it, you are able to track it over the years as you age, and you are excited about your health, because health does not just mean a doctor is managing me. We have moved from that to patient-centered care, where a patient is also part of their health, because that affects adherence, it affects communication, and it affects the patient's participation in their health. Women, for instance, from the age of 21 onward, every other 3 years, it is important to take the pap smear. Don't just say, I don't like the investigation. Cervical cancer is real and it's killing people.
That's right.
You don't have to become an index case if you have a screening test. The HPV vaccine is available. We can take those vaccines and prevent a predisposition to these diseases. That's for the younger ladies. For perimenopausal women, let me go back to the young ladies. It's not just about beauty and fashion. pay attention to your breast. You
That's
need to
true.
self-examine your breast. You
Hmm.
need to know what your breast look like. Look at the mirror. See what, so that when there's an abnormality, you are able to identify that something is off. I might not know what is wrong, but I know that something is off. Why? Because you have been paying attention to your health.
Right.
And so you can easily walk up to your doctor. Whatever is recommended in mammogram, it will keep you at peace even if nothing is wrong. But if something is wrong, it's going to be detected early.
Early, that's right.
Early detection is very important.
Very important.
Truth is that most of us operate at the secondary level of prevention, which is diagnosis.
Mhm.
We need to educate ourselves to identify our risk and prevent our predispositions. That is working at the primary level of prevention. You don't have to start having headache and you pop the pill every night to go to sleep. It's worrisome. See your doctor.
Hmm.
People get stressed, yes, but see your doctor. So those are if we want to talk about how to measure health, we need to actually look at a certain age group and talk on and on and on. So I will just hand over to you if you have any further direct
So
questions.
much, doctor. So basically, primary prevention must be taken seriously to prevent disease,
Absolutely.
injury before it ever occurs, and have
Absolutely.
optimal health we all, look for. Thank you so much, doctor. Now let's look at biological, social, and environmental factors. What are some biological, social, and environmental factors that affect our health?
Now, this you call their factors, absolutely. But let me modify and say that they are actually determinants too. It's saying that they are determinants makes us understand that they influence our health, whether we like it or not. So for instance, biological factors or determinants that affect health would include age. So those in the extremes of life, for instance, newborn babies, infants, and elderly people are more likely to be predisposed to disease because of their age group.
Mhm.
The little ones are building up their immunity. The immunity of the older ones is declining. So that's why they are more predisposed to diseases. Gender also affects. I gave an example of the pregnant woman earlier on. A woman pre-pregnancy is not the same as a woman during pregnancy. And you cannot compare the health of a pregnant woman with the health of a man within the same age group because her condition actually predisposes her more. Also, anthropometry, our adiposity, being underweight or having undernutrition as a problem might affect your health because you don't have enough to mount response to fight diseases. Being overweight, for instance, too might predispose you to other issues like diabetes, metabolic syndrome. Diabetes in itself also affects immunity. Wound healing, for instance, urinary tract infection. So you see why it's important, for instance, to know your glycemic control. I just mentioned 3 things as related to diabetes. We've not even gone into the nitty-gritty of how diabetes can affect health as a whole. So anthropometry, some of the predispositions might be that's for those who are extremely overweight or obese. Also, our race, our ethnicity the diseases that are peculiar to people in the tropics, for instance, those of us in the tropics will usually mention malaria as compared with Caucasians. So those are biological factors that affect health. Genetics, for instance, some people have diseases that run in their families that affects health generally. So someone, a newborn who has, say, for instance, a primary immunodeficiency syndrome is going to, that's highfalutin, but it's worthy of mention, is going to have challenges with fighting diseases. So essentially, our status biologically affects what kind of diseases we are predisposed to. Environmental factors. The funny thing about the environment is that human beings also play a part. There's the man-made aspect of our environment. So the influence of the environment on health and the influence of man on environment is bidirectional, and that affects health. So I would say, for instance, the fact that you notice that climate and climate change is actually affecting the occurrences of floods, for instance, storms, wildfires. Those affect health, because when you have wildfires, the animals that whose habitat is this forest are let loose, and then you have disease exchange between man and the animals, for instance. So that affects health. Flooding, for instance, we don't know where the water is coming from, of course, and the diseases inherent in that kind of water that affects health. We're in the era of the pandemic, the COVID pandemic. The air we breathe is an environmental factor, and it affects health. So depending on the season of the year, some diseases have higher incidences than the other, depending on the time of the year. So these things affect health. The microorganisms we have are a part of our environment. Those affect our health. So I'll take it a step further by saying that if you live in if you have a dirty field in your community, the manner in which it affects the health of that community is actually multidimensional. If it were supposed to be a football field, because it is dirty, people are less likely to go exercise. People are less likely to walk in the park. Children are less likely to play football.
That's right.
So that affects health, and that means our sedentary lifestyle is more prominent with that example I gave. Thank you very much.
All day at work, everywhere. We don't want to exercise our body. That's true. Now, doctor, so if all these factors are not being considered, I mean, if these measures are not taken, this means we are at risk of this unfair health. If we find it difficult to regularly measure or check our health status, right?
Yes.
So,
yes.
viewers, you just heard our guest, Dr. Ibiyo, telling us that we are at risk of these diseases, infections going around us if we find it so difficult to check on our health with our doctor or right in our house, like she mentioned. Breast examination, self-breast examination is very important. Please, ladies, women, let's do it, please. It's very important. Prevention is better than cure. Now, doctor, how often should we do this checkup? Because some people think that it's once a year. Because I've seen many people calling me that, okay, I did my checkup 6 years ago. I'm like, my goodness, Jesus. So I want you to enlighten us, educate us on how often should we do this checkup? please. It's very important.
Thank
Because
you
of our
very much.
time, and I want us to be time conscious because we're going to other segment in few seconds. Let us know, please.
Okay, thank you very much. For routine checkups, depending on an individual's risk, for someone who has no identified risk factor, we will say the person is relatively healthy, and you can go on to have your routine checks maybe 3 to 5 years. However, if you have identified risk, I'll still go back to the example of high cholesterol level. You need to monitor your cholesterol. At least 3 to 6 months will do, depending on how high it is. So depending on what risk your doctor has identified, that would affect how frequently you visit the doctor's office. So saying that 3 to 5 years or yearly or biannually doesn't cut it. It depends on the individual. It depends on the individual. That's the simple answer to the question. But it is important for you to know your status, know the level of your function, know your liver. If you've never seen a doctor before, go see a doctor immediately as soon as possible. Know your kidney function, especially those in the middle age. Know your liver function. Know the risks peculiar to your family. Know your ejection fraction, for instance. Have an echocardiography done. Thank you.
Thank you so much, doctor. Doctor, you're a medical doctor who is also aspiring in becoming neuro-oncologist. I want you to tell the audience, our viewers, what is neuro-oncology and what does a neuro-oncologist do? This question is for the sake of our viewers who do not know what this specialty does. Please, I want you to tell us in a few seconds what we should be expecting, because we're still bringing you back. Trust me, after your training, you're coming back on here to educate us on neuro-oncology. Please, go ahead.
Well, simply put, neuro-oncology is that field of neurology, that field of medicine that studies tumors of the brain and the spinal cord. And to simplify further, new growth, abnormal new growth in the brain and the spinal cord. And I'm looking to specialize to help in cancer treatment affecting those with brain tumors and spinal cord tumors and other areas of the nervous system. Thank you.
Wow, wow. So don't forget, you're coming back. Viewers, Dr. Ibiyo is still coming back on this show. So get ready for that, okay? And we're going to be talking about oncology, cancer, and so on. So be prepared to have her back on the program. So now, doctor, I also heard that you are a creative director running a baby fashion outfit called Sapphire and Purple
Palace, yes.
Did you learn this art of cloth design before your medical school or after? Tell us briefly about it and who are your target market?
Thank you very much. I actually, as a teenager, I started learning myself. So I'm self-taught in aspects of cloth design and dressmaking. I taught myself and I've evolved over time. So I learned before I went to medical school, and I've even learned more. My target population is the youth. I hope to be able to use my outfit to create jobs for youth development and possibly institutionalize fashion and the art of fashion in the fashion industry. So those are my target, the youth, creating jobs here in Nigeria and beyond. Thank you.
Wow, wow, this is awesome. Awesome in the sense that we see a doctor and also into fashion. My goodness, you know I love fashion, so maybe probably I will be one of your clients.
It's part of life. Art and fashion is part of life.
Wow, that's good. Congratulations. I must
Thank
commend
you
you for
very
that.
much.
Congratulations. And I also want to say thank you for coming on the show today.
Thank you so much for having
to
me.
empower us, to educate us on how it is important. That's the key word. Very important for us
It is.
on our health, to avoid so many things going on around us, not only on our body system, around us in general. Thank you so much, Dr.
Thank you so much for
Morohunmubo
having me here.
Ibiyo. God bless you. God bless your
Thank you.
household.
God bless you
And
too.
like I said earlier, we're going to bring you back on the show. So with this, I want to say, may God bless you, fill you with more wisdom, strength, and good health that you need in life. Thank you so much. God bless you.
Much for having
On healthy eating habits have contributed to a lot of health problems epidemic today. Health problems like diabetes, high blood pressure, osteoporosis, arthritis, cancer, health disease, and so on. The good news is, if you can control what goes into your mouth and your body, you will live your best. For what you put into your mouth determines how well or sick you live. You and I know that poor diet is associated with major health risks that causes illness and even death. So, by making smart food choices today can help you protect yourself from all these health problems. Our integrative nutrition health specialist, Miss Betty Olayinka Folani Akinlosotu, aka Bufa, wants to see you living your best without any health issues. She made this known in her program showing every Sunday on Healthy Living with Bufa TV. She tells us how our food choice affects our health and how we feel today, tomorrow, and in the future. If you are opting for optimal health, from fighting free radicals to living your way into a healthy and beautiful body, here are some things you must do. Eat a nutritious, healthy, balanced diet every day. Practice your daily exercise and take your supplements, especially vitamin D, vitamin C, zinc, and chlorophyll to boost your immune system against free radicals that cause cancer and other diseases. Join us on this program every Sunday, 1:30 p.m. US time, 7:30 p.m.
Okay, wow. We have to move on. We have to go. And I want you to please pay attention to this particular health talk we have today. This health tip is very, very important. So welcome back to Health Corner. Last week on Health Corner, we educated on metabolic disorder. Today, we are educating on major differences between strep and sore throat. Sore throat is very common, but we are unable to differentiate it because there's a difference in strep and sore throat. They all occur in our throats, but trustly, they are different. Because sometimes we mix it up. We cannot even differentiate, tell, or say whether it is sore throat or strep throat we have. So let's first understand both. What is sore throat? Sore throat is very common. That's what we have. That's what we think our children always have until we get to the doctor. So sore throat, it's also known as pharyngitis. It's the irritation, or you can call it inflammation of the throat as a result of viral infection. Mark that word, viral, that is viral. Viral infection, presence of injury, toxins, or irritants on the throat. It is also one of the common symptoms of cold, and it makes the throat, our throats, become itchy, painful, and sometimes dry. Sore throat happens when a mouth or respiratory infection spread to the throat. And on the other hand, strep throat is a very serious form of sore throat, and it's caused by bacteria called Streptococcus. Bacteria, viral for the sore throat, bacteria for the strep throat. Particularly, group A streptococcus, group A, because we have different, types of streptococcus. So type A, group A is the one that causes strep throat. And this condition is very also common in the children. It's something I've experienced in the past. And infection is very contagious. Mark that word, very contagious. That means if you have a kid that is you think is having sore throats, and you keep this child in the house without seeing your doctor, you might probably infect other children if you don't take that child to the doctor to determine whether it is a strep throat or sore throat, because strep throat is very contagious. It can be passed easily from person to person, and the symptoms are nearly identical to that of sore throat. So you never can tell whether it is strep throat or sore throat until you see a doctor that perform, tests to determine, because the symptoms are very identical. Now, let's look at the causes before the symptoms, because we have to know the reason why this thing happens, the causes of this thing before the treatment. The signs of strep throat include the skin rash. You begin to see rash. You begin to see your lymph nodes swelling up. That we call it swelling lymph nodes. White patches on the throat or spots on the roof of the mouth. Now, for basic understanding of the differences between streps and sore throat, this is the way you understand it. You will know the difference. Strep throat is caused by bacterial infection. That is when you see the doctor to tell you this is sore throat or strep throat. Then you know this is strep throat by getting the information from the doctor. So the strep throat is caused by bacterial infection, while the sore throat is caused by viral infection. And another thing you need to know to differentiate it is sore throat cannot be treated with antibiotics. You cannot use antibiotics to treat sore throat. It's something you have to, something in your house. All these, herbal stuff we have in our house can easily treat that. But the strep throat can be treated with antibiotics. That is when your doctor discovers that this is a strep throat, because it is a bacteria-caused condition. Now, let's look at the causes of both. First of all, it is very, very important we understand that sore throat is not always related to an underlying condition. No, it may be caused by irritants such as tobacco, alcohol, or spices that we have in our house. It can also be caused by straining throat muscle while yelling for a long time. African women, we yell even when we are just making things, or we are talking to people ordinarily, we yell. We yell unnecessarily. It's something I do too. I'm also guilty. So straining our throat muscle while yelling for long could be the cause. And lastly, throat dryness. If your throat is very dry, you would definitely, you might probably have, sore throat. However, the primary causes of sore throat can be as a result of toxins, airborne pollution, breathing polluted air, cough or heartburn, allergies, direct injury on the throat, acute viral pharyngitis, influenza virus, mumps virus, like I mentioned, streptococcus, pharyngitis, tonsillitis, and adrenal infection. And lastly, gastroesophageal reflux disease. This could be a primary causes of this infection, this sore throat or strep throat. Now, let's look at the symptoms. This is what you see when you have strep throat: fever, runny nose, headache, loss of appetite, sneezing, coughing, sudden change in voice, fatigue, nausea, vomiting, difficulty in breathing, and pain while swallowing are the symptoms. These are the symptoms you see. Don't mix up. When you have all these symptoms, definitely, first thing you know is you are having pain in your neck and on your neck right here. You can't swallow things. That you know that there is a pain in your throat. That means you have a sore throat. Then when you start having other symptoms, fever, running nose, headache, you can't eat, you can't sneeze, you are sneezing unnecessarily, you're coughing, these are becoming serious. So you need to see your doctor. That means it is not ordinary sore throat. Now, how do we determine whether it is caused by a virus or bacteria? That is what I think we should pay attention to now. And we call that diagnosis. You must be sure whether it is caused by a virus or bacteria before administering a treatment. Like our doctor said, we must see our doctor to determine what is going on our body system before we start taking medication. Some of us have slight headache. We start swallowing pills. You don't know what is going on in your body until the diagnosis is carried out. Now, normally, when a person has sore throat, the doctor will ask for the symptoms and examine the throat. This is what happens. The doctor will also check for the signs of other conditions such as air, sinus, or chest infections. However, it may be so difficult to diagnose just by looking at the throat. So this is the reason why you see the doctor taking further examination on that throat by conducting what we call a swab test to check for a strep infection. That's only the reason why they carry out the swab test, to know if it is strep throat or not. And this sample would then be taken and tested in the laboratory to further determine if the person has contracted strep or just sore throat. Now, after diagnosis, the result from the lab will now determine the treatment. Then your doctor will tell you, okay, go home, do this. It is not a strep throat, it's just a regular, ordinary sore throat. Then he will tell you. And if it is strep throat, you will be given antibiotics. What makes treatment different is most of the time, there is no exact treatment needed if sore throat is caused by a virus. The throat gets better even without treatment within 5 to 7 days. By taking some things you have, like a salt and water, warm water, and gargle your mouth, something like that. So you don't need medication. But antibiotics are not given in the back because definitely no doctor is going to give you antibiotics because it's a very powerful medication. Now, in contrast to that, when bacteria cause the condition, that is when you get that antibiotics. And it must be prescribed numbers of days. even if the symptoms have dissipated. This helps you or anyone to prevent future contraction of the disease if you take that measure. If you see the doctor and get medication, the right medication for that condition, for the strep throat or the sore throat. Now, here are some self-treatment that can help you in some of maybe less serious cases. These are, if you have this condition, you need to rest your voice. Avoid yelling and talking for longer time. Avoid dry air. You can use humidifier. And lastly, you need to avoid irritants such as alcohol. It's very important. You can't drink alcohol at that time. Now, take note of this. Strep throat can lead to more serious complications if left untreated. And what do we do to avoid complications? Here are the things you do when you notice that, okay, I'm having pain in my throat. If you notice difficulty breathing, swallowing, or opening your mouth, see your doctor. If you notice joint pain, headache, rash, and fever. If you have phlegm, we call it mucus. If you have phlegm and or blood in phlegm in the mucus. If you notice that sore throat or hoarseness keeps recurring. And lastly, if you have a lump in your neck, see your doctor. See your physician immediately to avoid complication. Now, for the children, you also want to take your children or your child to the doctor. Immediately, you notice that your child has difficulty breathing and swallowing associated with the sore throat. And if your child is drooling, you need to take immediate attention on your child and see your doctor. Having said all this, what is important is what goes in your mouth to your body, which is called diet. In this case, what you eat matters a lot. It is very important, and that will take us to nutrition segment. In a few minutes now, we have about, let's say 10 minutes to have our nutrition segment. So we're going to be having it shortly. In a few minutes, let's have our nutrition segment, and that will take us to the food that we need to avoid, and also the behavior we need to avoid if we have sore or strep throat. Number one, we need to stop smoking. We need to avoid fried food, cold food, or drinks. We should stop eating dry food. We should stay off caffeine. You can go for decaffeinated one. You must avoid acidic foods. You must avoid alcohol. You will definitely stay off soda. And you want to also avoid tomato juice or sauce. And lastly, don't eat raw vegetables at that time. Now, let's look at the food we must eat and things we must do to enhance the treatment process. You can eat warm food or take warm drinks. You can eat banana, turmeric, honey, ginger, scrambled egg, green tea, boiled vegetables like cabbage, carrots. You can take kiwi, cloves, cinnamon, fenugreek seed. These are the food you can eat at that time and more. I just gave you a few of that. As long as you avoid all those things that I mentioned, every other thing, it's okay for you. So now we have a few minutes to take, to do some remedies right here. You want to take tea, and how do you prepare that tea? This is what you need to do to fight and cure, excuse me, not only the sore throat, but also the common cold, the cough, or stuffy nose naturally. Let's make use of ginger, honey, and lemon tea, as well as onion. I need you to pay attention to this because I'm not just talking. I don't want you to go to doctor. In and out of the hospital must be reduced in our community with this program. It is not every day we go to the doctor for treatment. If we take precaution on time, we check our body, pay attention to what is going on in our body system, we won't be in and out of the hospital. Because these are the things we have in our homes that we can use to cure all these small illness. So now let's make use of ginger, honey, and lemon tea, and as well as onion. You want to cut the ginger into small pieces. You can leave the skin on if you want, if you can take it off. You want to slice this about a full cup of it. You want to slice the lemon to boil with water, just like you are doing a tea. Pour that in a cup after you boil it. You want to make sure all this you slice, ginger, lemon, boil them together with water and pour that in a cup and add honey. Mix it and sip before bedtime. Let me tell you what ginger does. Ginger is an anti-inflammatory property, and it helps boost our immune system. So these help us get rid of viruses and cause you to have the viruses that cause you to have sore throat or strep throat. Now, lemon are very high in vitamin C. They are natural antioxidants. They are antiviral and antibacterial properties. And that is why it's very, very important we make use of lemon. They are also very high in potassium. They regulate the kidney as well. They help alkalize the blood and the urine to give your body alkaline environment. Lemon also enhances immune system and help to fight off the cold and the flu. Also help to reduce the phlegm, that's the mucus that build up in the body as well. And what honey does in the body is it helps soothing the throat from itching, dryness, and cough. Honey also makes you feel very energetic and helps you to stay healthy. When you combine the ginger, all these that I mentioned, the ginger, the lemon, and honey, when you put all of this together into a tea, it's going to do wonders for that sore throat, cold, or flu. Try it. You feel much better as soon as you finish drinking the tea. And you can drink it before you go to bed. And what do you do to onion in a few seconds? What you also want to do is cut up an onion into smaller size. Put the onion right next to your bed when you go to sleep. Inhale all those aromas while you sleep. And when you wake up next day, I promise you, you'll feel much better. This is what I've done in the past. I've done this multiple times. Yes, in winter time, you can do it. It works really wonderful. So try this. Now, here are some things you can do. Apart from this I mentioned, you can mix salt and water, honey and lemon juice, ginger and lemon, coconut oil and apple cider vinegar, coconut oil and warm water, coconut oil and beverages or other drinks. Try all this. And for those of you who love to eat bitter cola, you've just prevented this infection, because eating bitter cola regularly when you have sore throat or when you don't have, it's also effective. It clears off the throat and the airways. So bitter cola is very effective in getting rapid recovery from cough, sore throats, and cold. That is all we have for you on the show today. I want to say thank you so much for joining us today. I want to wish you a good week ahead of you. I also want to leave you with this message. Look, I have given you every seed-bearing plant throughout the earth and all the fruit trees for your food, says the Lord, in Genesis chapter 1, verse 29. So what are you waiting for? Eat and be well. So I'll see you next week. Keep watching Healthy Living with Bofra Show. We bring you everything you need to know on wellness. I'll see you next week. I'm still your host, Betsy Olayinka Larry Akinlosotu, an advocate for wellness. See you next week and have a beautiful week.